I'd just like to thank everybody for coming today to our webinar on gestational diabetes, Know the Risks. Before I get started, I'd just like to acknowledge the Ngunnawal people who are the traditional custodians of this land on which we are presenting this webinar, and pay our respects to elders both past, present and emerging. My name is Leanne Elliston and I'm an accredited practicing dietitian with Nutrition Australia. I have been a dietitian for the past 20 years, working in a combination of clinical and community roles, and a lot in public health as well. And I've got with me Ellen.
Hi, I'm Ellen, and I'm also an accredited practicing dietitian with Nutrition Australia. I've been a dietitian for 3 years, mostly working in the community, but doing some private practice work as well. And I've got a daughter who's 2, and I'm currently pregnant with my 2nd child.
Pregnant, but not with gestational diabetes.
No.
Which is what we're here to talk about, is gestational diabetes and getting to understand what the risks are to both mum, bab and the entire family as well. Just a bit of an introduction about, whoopsie, pardon me, I went too far. A bit about Nutrition Australia. So we're a not-for-profit community-based organisation. We're all about inspiring healthy eating in the community. We have received funding from the ACT government through their Healthy Canberra grant focus on preventing diabetes to put together a program which we have called Nourish and Nurture, and it's really a preventative health initiative or program that targets the nutritional wellbeing of women to not only prevent the chances of getting gestational diabetes, but if they do end up with gestational diabetes, then it also is aimed at supporting their nutritional wellbeing and preventing them from getting type 2 diabetes later in life. So once we go through this webinar, you'll sort of get to understand where nutrition fits in a lot of areas, both pre, during and post-pregnancy, particularly when it comes to gestational diabetes. Just as an overview, what we're going to talk about in the next 40 minutes or so, I hope to finish by in 45 minutes. What it is, just describing a little bit about gestational diabetes. It has actually become a lot more prevalent in recent years, so we'll talk about that. Who is at risk of gestational diabetes? What causes it? What are the outcomes, the health outcomes for both mother and baby, and also the healthy lifestyle that a mum in particular, but the whole family need to consider pre-conception, during pregnancy or post-pregnancy. And then we'll talk about some other support and information that you'll be able to access to help you moving forward. So I'll pass on to Ellen, who's going to go through the first part of this webinar.
Okay, so just one quick thing, if you do have any questions while we're going through the presentation, please feel free to post it in the question and answer. We've got the box open, so we should see your question come straight through and be able to answer it in real time, hopefully. So firstly, we're going to talk about what is gestational diabetes mellitus. So it's a form of diabetes that occurs in pregnancy. And it's normally called GDM, and it can present at any time, but typically it presents in the 2nd trimester or early in the 3rd trimester, so between 24 and 28 weeks. Usually there's no symptoms, and it's diagnosed through an oral glucose tolerance test, and it usually does resolve after the baby is born. Pre-existing diabetes, so such as type 1 and type 2, continues to occur during pregnancy for those mothers who do have those conditions. So the incidence of GDM in Australia. So the latest figures from the Australian Institute of Health and Welfare indicate that the national average of GDM in Australia is 1 in 7 women, or 14% of all pregnancies are affected by GDM. The incidence varies among age groups, with older women, so women between 45 and 49 years of age, making up 25% of all cases. The ACT has a higher rate than the national average at 17% of all pregnancies. And this has increased from 6% in 2005 to 17%. And so we've gone from having around 200 cases per year to having nearly 1,000 cases per year. So this does place a lot of demand on our health services. Due to the small size of our health service here in the ACT, we aren't able to cope quite as easily. So just bearing in mind, between 2000 and 2001 and 2016 to 17, the rate of women being diagnosed with gestational diabetes in Australia tripled. So steep increases were recorded from between 2012 to 2013 across all age groups and states and territories. Caution should be taken when comparing these, however, because during that time, new diagnostic guidelines were introduced and the level of fasting blood glucose level dropped to 5.1 from 5.5. So that's quite a big drop. So it means that more women were being diagnosed. So as I already said, ACT has the highest rate of GDM in Australia. Okay, so who is at risk of developing gestational diabetes? All pregnant women can get gestational diabetes. Women at higher risk of developing GDM include those who are aged over 40 years, have had gestational diabetes in a previous pregnancy, have a history of elevated blood sugars, have a family history of type 2 diabetes, or a mother or sister who have experienced gestational diabetes, those who are above a healthy weight range or gain weight too rapidly in the first half of the pregnancy, those who have polycystic ovarian syndrome, and those who are taking certain antipsychotic or steroid medications. Okay, so as you can see from this graph, the incidence of GDM across population groups. So as you can see, the women in the 45 to 49 year age group do make up almost 26% of women diagnosed with gestational diabetes. And as we can see, this does increase as age increases. Okay. So women, the incidence of GDM across population groups, women from lower socioeconomic groups are 1.6 times more likely to be diagnosed compared to women in the highest socioeconomic group. In addition, Aboriginal and Torres Strait Islander women are 1.3 times more likely than non-Indigenous women to be diagnosed with gestational diabetes. And compared with women born in Australia, those women born in Southern and Central Asia are more than twice as likely to be diagnosed. Women born in Southeast Asia are 1.7 times more likely to be diagnosed with gestational diabetes, and women born in North Africa and the Middle East and Northeast Asia are 1.6 times more likely to be diagnosed with gestational diabetes. So as we can see in this particular diagram, the incidence of GDM across the ethnic groups, as you can see, the Southern and Central Asian women do make up a majority of those women diagnosed with gestational diabetes. They have the highest incidence. As you can see, Australia is quite low compared to those women from Southern and Central Asia, as well as Southeast Asia, Northeast Asia, North Africa and the Middle East, and Oceania represents those women from the Pacific Islands. So in order to understand what causes diabetes and in turn understand what causes gestational diabetes, we first must understand what happens in our body when we eat carbohydrates. So glucose is an important source of energy for the body, which comes from carbohydrate foods such as bread, pasta, rice, cereals, our fruits, starchy vegetables, milk and yogurt. The body breaks down these carbohydrates into glucose, which then enters the bloodstream. Insulin, which is made by the pancreas, acts as a key, allowing glucose from the bloodstream to enter the body cells and be used for energy. Diabetes is a condition where there is too much glucose in the bloodstream, and the insulin, or the key to let the glucose into the cell, is either not working properly or the pancreas cannot produce enough of it to mop up the glucose. Diabetes can have damaging effects on blood vessels, such as those in the kidneys, eyes, and feet. So moving on to what causes gestational diabetes. In pregnancy, the placenta produces hormones that help the baby grow and develop. These hormones also block the action of the woman's insulin. And if we think back to the previous slide, this means that there is no key letting the glucose into the body cells, meaning that the circulating glucose levels will be higher. This is known as insulin resistance. And because of this natural insulin resistance that occurs in pregnancy, the need for insulin in pregnancy is 2 to 3 times higher than normal. So if you already have some level of insulin resistance, then your body may not be able to cope with this extra demand, and the blood glucose levels will be higher, resulting in gestational diabetes being diagnosed. So this brings us to the treatment for GDM. There is no one-size-fits-all treatment plan, and a treatment plan will be developed by the healthcare team when a woman is diagnosed. This includes a doctor, dietitian, as well as a credentialed diabetes educator. However, one thing that is consistent across all GDM treatment plans is that women should be regularly monitoring their blood glucose levels. Normally, this will be between 3 and 4 times a day, usually before breakfast, before lunch or dinner, 2 hours after a meal, and before bed. Most women can manage their gestational diabetes with diet control and regular physical activity. But if their blood glucose levels cannot be managed by diet and physical activity alone, then they will need to take medication, such as a diabetes drug called metformin, which is actually the only one that is safe for use in pregnancy, or they'll have to have insulin injections. Effective management of gestational diabetes will reduce the complications during the pregnancy and the birth of the baby. And usually gestational diabetes does resolve after the birth, and 30% of women will need to use insulin injections. Okay, so this graph demonstrates the type of gestational diabetes management by age group. As you can see, the majority of women are able to control their gestational diabetes through diet, exercise, and lifestyle management, which you can see in these blue sections across the top. However, they do slightly decrease in size as age increases. Treatment with oral hypoglycemic therapy, which would be metformin, is represented by the purple, and this is pretty consistent across the age groups. The green is represented by those treated with insulin, and as you can see, this does increase as age increases.
All right, so moving on to the outcomes and the effects on the mum, and particularly the bub when it comes to gestational diabetes. Particularly the short-term health outcomes for mum are they can suffer from gestation, more likely to suffer from gestational hypertension, so high blood pressure during pregnancy, and are at greater risk of preeclampsia as well. So that's a bit of another level of high blood pressure, where there's also the protein in the urine, and it becomes more of a dangerous pregnancy, I suppose. Women who have gestational diabetes may be more likely to end up having to have an induced labour. They have a greater likelihood of interventions, so caesarean deliveries. And one of the effects of gestational diabetes, particularly if it's not well controlled, is the baby can grow too large and become what we call macrosomia. And that's, babies more than, say, 4.5 kilos. Is considered quite large, and there can be injury to the mum in regards to the delivery of a large baby. Some mums may also find that establishing breastfeeding can also be a little bit more difficult as well, but as we'll talk about towards the end, it is really quite important to try, as much it might be a little bit more difficult, it's very important to really try and persist with the breastfeeding because of the long-term health benefits to both mum and bub with that. Long-term risk for mum is, well, they do have a greater chance of developing gestational diabetes in consequent pregnancies, and also, in fact, they will have a greater risk of developing type 2 diabetes later in life. So half of women in Australia with GDM do go on to develop type 2 diabetes in later life. So that's a fairly significant risk there for the mum, again, which is where that lifestyle is really, really important in relation to minimising the long-term risks of developing type 2 diabetes. They may also be at higher risk of metabolic syndrome and cardiovascular disease. So with the metabolic syndrome, generally what occurs with that is it's a combination of high weight gain and what we would call with, elevated levels of or insulin resistance, not necessarily diabetes, but insulin resistance, high blood pressure, those sorts of things that can occur and are certainly contributed by lifestyle as well. As for bub, what are the outcomes for bub? Well, bub can get too large for their gestational age, particularly for diabetes, gestational diabetes that is not well controlled. They may also suffer from low blood sugars soon after they're delivered. And some babies may have some breathing difficulties, or there may be some associated birth injuries, particularly if they were delivered at a large gestational, a large weight. Particularly babies of mothers with pre-existing diabetes. So they're the mothers who may have type 1 diabetes or already have type 2 diabetes before they were pregnant. So it's not a diabetes that has occurred during pregnancy. But those babies of mothers with the pre-existing diabetes certainly have a higher risk of adverse complications than the gestational diabetes alone. It's worth being aware of that. The long-term risks for babies, so many of the babies actually born to mothers with gestational diabetes don't have significant health-related problems, but research is telling us that they may be at increased risk, just like the mum, of obesity and type 2 diabetes later in life. So again, that brings us back to what can we do to prevent those conditions from occurring, and a lot of that does come back to our lifestyle, which we'll go on to shortly. So prior to falling pregnant in the first place, thinking about healthy lifestyle, before even conceiving, some things that mum needs to be conscious of is, and father as well, so it's both mother and father, about trying to have that healthy lifestyle. The great thing about when women fall pregnant is they tend to be a little bit more conscious of what they're eating and their health, because they're not only looking after themselves, but they're looking after their growing baby as well. So it's a perfect time to really take stock at what are you eating, how well are you looking after yourself, being physically active, that sort of thing is really, really important. So before pregnancy, always managing a fairly balanced diet, and minimising intake of discretionary foods. So there are sometimes foods or junk foods, such as your soft drinks and your bickies and cakes and chips and things like that. Also being careful of your alcohol intake. Certainly whilst pregnant we avoid it, but we shouldn't be having too much to begin with, even whilst we're trying to conceive. And I think it's really important to acknowledge that you know, particularly things like the junk foods and the high convenience foods, they are such a large part of many individuals' diets, and we know that it can make up about 1/3 of most people's energy intake. So it really is a problem when we have too much of those discretionary foods, because they're displacing the healthy foods that we should be having every day. Of course, regular exercise and trying to have a healthy weight to start with before falling pregnant is really good. So if you are trying to conceive and you might be quite overweight, then taking some measures to try and bring your weight down to become healthier to begin with. Certainly, pregnancy is not a time to focus on losing weight. It's about getting that healthy weight before falling pregnant. Whilst pregnant, some things to be mindful of. Continuing to eat a balanced, nutritious diet, of course, trying to get all the nutrients that both you and Bub require. And other factors to be mindful of are minimising the risk of foodborne illnesses. So pregnant women are what we would consider a vulnerable group, so more at risk of suffering from foodborne illnesses. So food safety is really important during pregnancy, making sure that your food is fresh, that you're not having leftovers that have been sitting around in the fridge for a few days, reheating food properly, making sure it's properly heated up. And we pay particular note to things like salmonella and listeria. So salmonella obviously is one of those nasty bacteria that occurs particularly in uncooked meat or uncooked poultry, and can also be a problem with raw eggs as well. We've all heard about some of the salmonella outbreaks that's occurred in certain outlets in Canberra. And listeria is a nasty bacteria that affects pregnant women and exists in particularly unpasteurized dairy foods like unpasteurized milk and cheeses. Also soft cheeses will be a risk of listeria. Some salad type options, or cut up salad and cut up fruit salad. So always best to try and have those things as fresh as possible, cut it up yourself. Because, you know, any woman who does get listeria infection, it does cause miscarriages. So it's a very serious condition. Also being aware of things like mercury in food. So main sources of mercury in the predatory fish species. So the more common one is like shark. So there is more information about where you can get more details on you know, listeria risks, salmonella and mercury and so on, which we'll be filling you in about later through our website. Some often during pregnancy, taking a pregnancy multivitamin is recommended, particularly women are needing more folate and iodine, which can sometimes be challenging for some women in getting that through the diet. Avoiding alcohol, so pretty happy with the latest alcohol labelling announcement that all alcohol must have a clearly labelled notice or warning that alcohol can harm the developing fetus. No amount whatsoever is safe, so we advise just complete abstinence from alcohol during pregnancy. And of course, monitoring weight, so monitoring that weight gain during pregnancy, and how much a woman gains, how much weight they gain is really dependent on their pre-pregnant weight. So it is quite important just to keep a watch on that, because as Ellen mentioned earlier, if there's a real rapid weight gain in the early stages, then that can increase risk of developing gestational diabetes. All right, after pregnancy, so healthy lifestyle post-pregnancy, whilst, you know, if say for instance, you know, you've had gestational diabetes, as soon as baby's born, the diabetes goes away. So, but it doesn't mean that you can go back to eating whatever, or just you know, happy days, because the risk of getting type 2 diabetes, particularly in that mother is quite high, as you just saw earlier. So that's going to be the goal now, is to really try and maintain that healthy lifestyle for the rest of their lives. So, and it's a healthy lifestyle not only for mum, but also for the baby and the whole family. And so it might be incorporating some family lifestyle changes, whether it's, you know, less takeaway, more cooking from home, getting into some more activities, and really supporting us, particularly the child, in establishing healthy eating habits and becoming, you know, picking up physical activity and sports and things like that to prevent them from also getting type 2 diabetes later on. Supporting breastfeeding, I mentioned earlier that it could be a little bit difficult for mums with gestational diabetes to start breastfeeding or continue to breastfeed. And as I mentioned, it's such an important thing for both mum and bub, and particularly in relation in regards to the baby, can reduce their risk of obesity and type 2 diabetes later in life. Also, multiple benefits to mum as well, in regards to helping to lose that weight gain she's put on during pregnancy. And also there's, you know, research to tell us that it can help to reduce their risk of getting breast cancer in the future as well. And I just want to make a note that, you know, there's support organisations out there and places where we can go to get advice, and Breastfeeding Australia would be the Australian Breastfeeding Association is a fantastic organisation, and they do a lot of breastfeeding support and advice for all mums, but in particular, you know, mums who have had gestational diabetes may find ABA particularly helpful. They have some classes afterwards and they're a really good support group, so do be mindful of that. Some other places where you can go for support. So Diabetes Australia have developed a new program called Capital Chicks Canberra, and they've developed that program using the similar sort of funding that we receive to do our Nourish and Nurture work, and that is really about supporting mums or supporting women who are even planning a pregnancy. So it's not necessarily for those with gestational diabetes, but it's about making sure that they are healthy before, during and after their pregnancy. It's a really good support initiative as well. So there's lots of fantastic resources online and opportunity to receive advice from the experts. So particularly those women who do have gestational diabetes or who have had it, I would encourage that they get onto this Capital Chicks Canberra as a support network and group. Coming up to a close fairly soon, but I just wanted to also fill you in a little bit more on some resources and services that you can access. So with the Nourish and Nurture project, what we did was we developed a range of food literacy activities, and we did deliver those towards the end of last year. We planned to do more this year, but unfortunately, thanks to COVID restrictions, we couldn't finish off the rest of those sessions. But based on what we did last year, and this was through the child and family centres and the groups, the parent groups, the family groups that attend there, we did I think 8-week program where each week we're cooking different foods, and also engaging with the children as well, and helping them try new foods and set up healthy habits. And that's what Nourish and Nurture is all about. It's about looking back to that lifestyle, these long-term lifestyle improvements or things that we need to be working on from a nutrition point of view that Nourish and Nurture is working on. So we've got a suite of nutrition information on our website, so you can go onto the ACT Nutrition Support Service website, where we've developed some fact sheets specifically for mums and pregnant mums. We tried to keep them really simple and to the point, so there's not a laborious read in them. We've got recipes. We will be housing webinars as well on that website, and we have a seasonal e-newsletter that comes out which targets particularly pregnant mums and post-pregnant as well. We've developed a manual based on our food literacy program that we delivered last year, and that manual is really available for anybody to access and deliver their own cooking activities. So if you are a support worker or a leader in an organisation, or you might even just be a group of mums that get together occasionally, get onto this manual and get some ideas of some foods that you could be cooking, and also has some really useful ideas in regards to setting up healthy eating habits for young children and the whole family, because it is something that the whole family needs to get on board with. Where to next? So as I was mentioning with the manual, it's going to be launched when we run our next webinar, which will be in mid-August. So do keep an eye out for that, because we'll be going through some more details in regards to, you know, promoting a healthy lifestyle with good nutrition, and how, you know, food literacy plays a role in that, and setting up healthy cooking habits helps to create healthy eating habits. The toolkit will include menu planning, healthy recipes, and kids cooking activities, and it's really going to be it's really developed specifically for the families that have been touched by gestational diabetes in some way. But it's going to contain information that is also of a general nature, so we'll all get some benefit out of it. Right, so thanks everyone for having us, and if you'd like to review this webinar or share it with others, it will be available on the Mums and Bubs section of our website, Nutrition Support Service website, and we'll be letting you know when that is available. So thank you, and all the best.